Hello, my name is Trina Ganguly, and the date today is June 2nd, 2023. Today I'll be discussing Parkinson Syndrome, which affects the nervous system. Parkinson Syndrome, also known as Parkinsonism, refers to a group of neurological disorders that share similar clinical manifestations. And the most common and well-known form of Parkinsonism is Parkinson's disease. Some of the general clinical manifestations that accompany Parkinson's syndrome are motor symptoms, such as bradykinesia, which is slowness of movement and difficulty initiating voluntary movements. Resting tremor, which is a characteristic tremor that occurs when the affected limb is at rest and diminishes with voluntary movement. Next, there's rigidity, which is increased muscle tone resulting in stiffness and resistance to passive movement. And postural instability, which is impaired balance and coordination leading to difficulties with posture and gait. Second, there are non-motor symptoms, such as cognitive impairment, since Parkinson's syndrome can lead to cognitive decline, including problems with memory, attention, and executive function. Autonomic dysfunction, and this may involve symptoms such as orthostatic hypotension, which is low blood pressure upon standing, constipation, urinary problems, and excessive sweating. Sleep disorders, which is when patients may experience disrupted sleep patterns, including insomnia, restless leg syndrome, and rapid eye movement sleep behavior disorder, which also is known as REM sleep behavior disorder. And mood and behavioral changes such as depression, anxiety, apathy, and impulse control disorders can also occur. Now, let's differentiate Parkinson's syndrome from three other syndromes of the nervous system. First, we have essential tremor. In terms of tremor characteristics, unlike the resting tremors as seen in Parkinson's syndrome, essential tremor manifests as an action tremor occurring during voluntary movements and is usually bilateral. When it comes to distribution, essential tremor typically affects the hands, head, and voice, whereas Parkinson's resting tremor primarily affects the hands. And in terms of response to medication, essential tremor responds well to medications like beta blockers and anticonvulsants, whereas Parkinson's disease shows a limited response to these drugs. Second, we have multiple system atrophy, which is also MSA. For autonomic dysfunction, MSA is characterized by severe autonomic dysfunction leading to significant postural hypotension, urinary incontinence, and sexual dysfunction. These symptoms are less prominent or absent in Parkinson's syndrome. In terms of Parkinsonism features, MSA shares some Parkinsonian motor symptoms with Parkinson's disease, but it progresses more rapidly and often shows poor response to levodopa therapy. And as for additional features, MSA may also involve cerebellar dysfunction causing ataxia, which is uncoordinated movements, and other cerebellar signs which are not typical in Parkinson's syndrome. And as our third other syndrome, we have progressive supranuclear palsy, or PSP. And so regarding eye movement abnormalities, PSP is characterized by early and prominent eye movement abnormalities, including vertical gaze palsy, which is difficulty in moving the eyes vertically, and problems with convergence and focusing. These eye movement abnormalities are not typically seen in Parkinson's syndrome. And next we have postural instability. And so regarding this, PSP often presents with severe postural instability and falls early in the disease course, whereas the symptom typically develops later in Parkinson's disease. And last, in respect to cognitive and behavioral changes, PSP often involves significant cognitive and behavioral changes, including executive dysfunction, personality changes, and disinhibition, which are less typically seen in Parkinson syndrome. And finally, 3 diseases included in Parkinson syndrome are Parkinson's disease, which is the most common form of Parkinson syndrome. PD is a progressive neurodegenerative disorder characterized by the gradual loss of dopamine-producing cells in the substantia nigra region of the brain, and it primarily affects motor function, but can also involve non-motor symptoms. Next, there is Parkinson plus syndromes, which are a group of neurodegenerative disorders that share some Parkinsonian features, but have additional characteristic clinical features. And examples of this include multiple system atrophy, which is MSA, progressive supranuclear palsy, which is PSP, and corticobasal degeneration, also known as CBD. And last, there are drug-induced Parkinsonism, in which some medications, such as antipsychotics or antiemetics, can cause Parkinson-like symptoms. However, unlike other forms of Parkinsonism, drug-induced Parkinsonism is reversible and improves when the medication is then discontinued. And so overall, since there are so many different types of conditions and syndromes within Parkinson's syndrome, it's important to consult a healthcare professional or an expert in the subject matter for an accurate diagnosis and differentiation between which syndrome or disease the patient can have, since they require very detailed clinical evaluation and can sometimes even require specialized testing. Thank you.